The coronavirus disease 2019 or COVID-19 is a respiratory illness that can spread from person to person. Only two coronaviruses have previously caused global outbreaks. The first of these was the SARS coronavirus, which first started spreading back in 2002, also in China. The other one was the MERS coronavirus, which emerged in Saudi Arabia in 2012. The virus that causes COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China. The virus that causes COVID-19 emerged from an animal source, allegedly a bat and a pangolin, from a market in Wuhan, China, but is now spreading around the world. Here's the virus spread timeline of events. In December 31, 2019, the World Health Organization says mysterious pneumonia sickening dozens in China. January 11, 2020, China reports first novel coronavirus death. January 21, 2020, first confirmed case in the United States. January 23, 2020, China imposes strict lockdown in Wuhan. January 30, 2020, the World Health Organization declares global health emergency. February 5, 2020, the Diamond Princess cruise ship quarantined. February 11, novel coronavirus renamed as COVID-19. February 26, first case of suspected local transmission in United States. February 29, the first death was reported in United States. March 13, Trump declares national emergency. March 17, coronavirus now present in all 50 states. March 18, China reports no new local infections. March 19, Italy's death toll surpasses China's. March 20, New York City declared U.S. outbreak epicenter. The virus is thought to spread mainly between people who are in close contact with one another within about 6 feet through respiratory droplets produced when an infected person coughs or sneezes. It also may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. Risk of infection with COVID-19 is higher for people who are close contacts of someone known to have COVID-19, for example, healthcare workers or household members. Other people at higher risk for infection are those who live in or have recently been in an area with ongoing spread of COVID-19. Those at higher risk for severe illness from COVID-19 are people 65 years and older, people who live in a nursing home or long-term care facility, people of all ages with underlying medical conditions, particularly if not well controlled. In order to slow the spread of the virus, the government issued a nationwide quarantine. Schools were shut down. Public accommodations like restaurants closed, but critical services remain open like groceries and hospitals. A strict social distancing is imposed. This includes maintaining at least 1 meter or 3 feet distance between yourself and anyone who is coughing or sneezing. The use of masks should cover the nose and mouth and be tightly secured. People should thoroughly wash their hands for at least 20 seconds multiple times a day and maintain overall cleanliness and good hygiene. Patients with COVID-19 have had mild to severe respiratory illness with symptoms of fever, cough, and shortness of breath. Some patients have pneumonia in both lungs, multi-organ failure, and in some cases, death. Currently, no antiviral medication is recommended to treat COVID-19. Treatment is directed at relieving symptoms and may include pain relievers like ibuprofen or acetaminophen, cough syrup or medication, rest, and fluid intake. In hospital settings, they heavily rely on ventilators. There is currently no vaccine to protect against COVID-19. As of April 8, 2020, there are 1,469,245 coronavirus cases worldwide and 86,270 deaths. Estimated COVID-19 mean infection rate is 2.5%. So far, international companies have had to contend with shuttering stores in affected areas, accommodating sick and worried employees, and dealing with supply chain disruptions. The outbreak is inevitably having an enormous impact on the travel industry. ranging from hotel and cruise ship quarantines to airlines halting flights in some regions. Big shifts in stock markets where shares in companies are bought and sold can affect many investments in pensions or individual saving accounts. Investors fear the spread of the coronavirus will destroy economic growth and that government action may not be enough to stop the decline. In response, central banks in many countries, including the United Kingdom, have slashed interest rates. That should, in theory, make borrowing cheaper and encourage spending to boost the economy. The coronavirus has changed how we work, play, and learn. Schools are closed, sport leagues have been cancelled, and many people have been asked to work from home. Despite this dark time for humanity, the coronavirus pandemic is having some positive side effects on the environment. The water looks clearer in the world-famous canals in Venice, Italy, in Wuhan, China, and other parts of the world, and NASA images show how pollution is dropping rapidly in cities across the globe. On top of air and water, wildlife may respond to change as well. Perhaps the dim light at the end of this long and distressing SARS-CoV-2 tunnel could be a healthier environment in cities worldwide.